I do want to start with something personal. You had COVID, so did your husband. He was recently released from the hospital. How are you both doing? And what did this COVID experience teach you?
Thank you, Stephanie. And I know you've been going through a lot on this front as well. I had very mild symptoms. My partner, Marlon, had headaches the first few days, felt ill, but then around day 7, 8 developed shortness of breath. His doctor advised him to go in. He had very high levels of lung inflammation. He was given steroids. He only had to spend 2 nights in the hospital. So we're blessed. We're all healthy. We're all happy. We're doing great. Thanks for checking. How's your family doing?
My family is doing very well. My takeaway, though, was I can't believe how poor our testing is. Having experienced it yourself, has it changed the way you are going to test in the state of Colorado? So difficult to get access to testing, and the turnaround time for results can last days.
So we've really doubled down on testing early. We have a number of free, quick and easy, over 50 sites across our state where you can simply go in and get out probably in 20 minutes or so. And we've worked real hard to get the time back to 1 day to 2 days. So about 40% of the tests within 24 hours, over about 90% within 2 days results. We also have deployed the instant Binax test. Now they're not as accurate, but they give you results in 15 minutes, and they're very helpful in screening folks who may be asymptomatic out from working in nursing homes or prisons.
So if you got the testing figured out, how are you going to roll out this vaccine?
Well, I wish we had more of it to roll out sooner, but we have what we have. As you know, the federal government placed its orders. It's being distributed pro rata to the states. Our first allotment was over 40,000 for this week. Next week, over 80,000, and it goes right out. We have a rule in Colorado. You have to use it within 72 hours. Any of our partners that gets it, or we assign it to somebody who will. Many of our healthcare workers have been receiving it yesterday, today, folks that work in COVID wards. It's just amazing to hear their stories, Stephanie. I heard from folks who basically have been living in a separate room in their home because they didn't want to risk contaminating their family for months. I mean, this is what some of the folks who take care of those who are ill go through every day.
What are you doing to make sure your most vulnerable communities get access to the vaccine when it's available?
We're prioritizing those who are at higher risk from the virus, which correlates very closely with age. So over 65, people with pre-existing conditions. Next week, many of our nursing home residents will be receiving it. And then we're rapidly expanding as the supply permits to folks over the age of 65 and with pre-existing conditions. It's a much more deadly virus, not 2 times, not 5 times more deadly, Stephanie, but 100 times more deadly for people in their 70s and in their 20s. It's a profound difference. We want to save lives.
The last time you were here with me, we talked about your efforts to keep businesses going in your state. You had a very detailed plan. How are businesses surviving in Colorado compared to the rest of the country?
Well, we're grateful our unemployment rate's a bit lower. We're doing our best here. We just launched something that we call the 5-Star program. It was an innovation out of Western Colorado, Mesa County, which successfully was able to keep more businesses open by having them sign up to have higher levels of protocols, to be certified as safe, with mask wearing and ventilation and other aspects that they have a independent source verify, and then they could increase that capacity. They never had to shut down in-restaurant dining. It's at reduced capacity, but other parts of our state have. But other than restaurants and gyms, our stores have been open. Everything else has been going reasonably well, but it's not going well for anybody till we defeat this virus.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.